I think social prescribing gives a really valuable non-medical offer to people that builds on people's strengths, builds on people's interests and is very person-centred. So it really sort of enables to sort of work from where someone is.
Where we're looking around deprivation and unemployment, and we've got models within one of our PCNs where we're working with the Department of Work and Pensions. We're looking at people that have been signed off sick and we're looking at how we can help them get back into work.
We have now formed SPLW champions in each and every practice in our PCN, and we all meet on a monthly basis.
In terms of outcomes, and this is really important to us as GPs, as our workload is so high, one of the reasons why we've done it is because we know it will reduce reattendances at the practice, reduce consultations by about 25 to 28%. We saw a reduction in A&E attendances in some of the patients that got involved in these activities.
When I make calls to patients, people who are socially isolated, then I'd mention, well, I've just started this allotment group up, which is a drop-in on a Tuesday afternoon for a few hours. There's Knit and Natter, there's the Sing-Along, Feed the Birds, there's the ARC Centre.
There's lots and lots of things out there, lots of really kind people, lots of voluntary groups, lots of community interest companies that can definitely help anybody in any situation.
There's a lot of things in keeping positive, either physically or mentally, having a laugh, having fun. People sustaining exercise and health, affordability around here is a big issue. So we run classes here. We've said it's either free or £1.
We will be able to shape positive social action with this group, giving them things to get involved in, a sense of pride in what they're doing.
Social prescribing has helped me change my life, simple as that. Everybody's telling it me now. Even my friends are saying, oh, you'll be great with this because you're good with people. I didn't realise. I was just so down and depressed and anxious, struggling. So getting out in the community just helped me to get to where I am now, yeah.
And we all help each other. We work together as a team, which is brilliant. So it's just not like we're working as individuals.
I was out of work for 10 years being a stay-at-home mum and came across the role and just thought it fitted really well as a mother who has helped support, my children as well as other parents. Like, it's quite nice to sort of be able to transfer those skills to the wider community.
This place we're in now is called START, one of our Wellbeing Matters social prescribing anchor organisations, and they also have a key role in our new Living Well service, which is a service we've developed for particularly people who are too complex for primary care but don't meet current thresholds around secondary care. What we did when we started designing Living Well was immediately involve social prescribing in colleagues in that design process, and I think we need to try to take that approach into our wider system design, so always be sort of saying when we're developing a new service offer, designing a new delivery model, what's the role of social prescribing in that? It would be brilliant if we could get to a place where it's almost an innate question we ask ourselves.